Understanding hairy cell leukemia. Causes, signs, symptoms, and treatment. Hairy cell leukemia, HCL, is a rare type of chronic leukemia that primarily affects B cells, a type of white blood cell. The name, hairy cell, comes from the hair-like projections seen on the surface of leukemia cells under a microscope. Here's an overview of this condition. Causes. 1. Genetic mutations. BRAF V600E mutation. Most cases of HCL have a specific genetic mutation in the BRAF gene, BRAF V600E mutation, which contributes to abnormal cell growth. Other genetic changes. Additional genetic mutations may also play a role in the development of HCL, though specific causes are not fully understood. 2. Risk factors. Age. HCL is more common in middle-aged and older adults, with the average age at diagnosis around 55 to 60 years. Gender. It is more common in men than in women. Signs and symptoms. Early-stage HCL. 1. Fatigue. Persistent lack of energy. 2. Weakness. Feeling weak or easily fatigued. 3. Abdominal discomfort due to enlarged spleen, splenomegaly, or liver, hepatomegaly. 4. Bruising or easy bleeding from low platelet counts, thrombocytopenia. 5. Recurrent infections due to compromised immune function. Advanced stage HCL. 1. Increased infection risk, more frequent and severe infections. 2. Pain or fullness in the abdomen, enlargement of the spleen or liver. 3. Weight loss, unintentional weight loss. Diagnosis. 1. Blood tests. Complete blood count, CBC, detects low levels of red blood cells, anemia, white blood cells, leukopenia, and platelets, thrombocytopenia. Peripheral blood smear. Examination of blood under a microscope shows hairy cells with unique projections. Bone marrow biopsy confirms the presence of hairy cells in the bone marrow. 2. Immunophenotyping. Flow cytometry identifies specific markers on the surface of hairy cells to confirm the diagnosis of HCL. Treatment. 1. First-line therapy. Cladribine. 2-CDA. A purine analog that targets and destroys hairy cells, often given as a short course of intravenous or subcutaneous injections. Pentostatin. Another purine analog that may be used as an alternative to cladribine. 2. Second-line therapy. Rituximab. A monoclonal antibody that targets CD20 on B cells, sometimes used in combination with purine analog. BRAF inhibitors, vemurafenib, dabrafenib, target the BRAF V600E mutation in HCL with this specific genetic abnormality. 4. Supportive care. Antibiotics. To prevent and treat infections. Blood transfusions, if severe anemia or thrombocytopenia occurs. Prognosis. Generally favorable. With appropriate treatment, many patients with HCL achieve long-term remission. Recurrence. Some patients may experience relapses, requiring retreatment. Follow-up care. 1. Monitoring. Regular blood tests and bone marrow biopsies to monitor response to treatment and detect any signs of relapse. 2. Symptom management. Addressing and managing symptoms such as fatigue, infections, and abdominal discomfort. 3. Psychosocial support. Counseling and support services to help patients cope with the emotional and psychological aspects of living with HCL and its treatment. This structured overview provides essential information about hairy cell leukemia, HCL, covering its causes, signs and symptoms, diagnostic methods, treatment options, prognosis, and follow-up care. Early diagnosis and appropriate management are crucial for improving outcomes and quality of life for individuals with HCL.